First Aid 2021, Section 3, page number 723. Rapid review. Classic labs or findings. On the left side, there is lab diagnostic finding. On the right side, it is diagnosis or disease. So let's start. I think this will be the last video for classic labs and finding, as I will be covering 724 also in this video. So let's start from the beginning. The first one is deep pigmentations of neurons in substantia nigra. Deep pigmentation of neurons in substantia nigra. Deep pigmentation of neurons in substantia nigra, that is Parkinson's disease. It is a basal ganglia disorder in which there is rigidity, resting tumors, bradykinesia. It is a basal ganglia disorder. Parkinson's disease is a basal ganglia disorder. The features we see in this condition are rigidity, resting tumor, bradykinesia. Sorry for that. Deep pigmentation of neurons in substantia nigra. 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 Parkinson's disease, basal ganglia disorder, rigidity, resting tumors, bradykinesia. Next one, protein aggregates in neurons from hypophosphorylation of tau protein. Protein aggregates in neurons from hypophosphorylation of tau protein, that is neurofibrillary tangles. That is seen in Alzheimer's disease and Pick's disease. Protein aggregates in neurons from hyperphosphorylation of tau protein. Protein aggregates in neurons from hyperphosphorylation of tau protein. It is neurofibrillary tangles. Alzheimer's disease and Pick's disease. Silver staining spherical aggregations of tau protein in neuron. Silver staining spherical aggregation of tau protein in neuron. Silver staining spherical aggregations of tau protein in neuron. Silver staining spherical aggregations of tau protein in neurons. Pick bodies. Frontotemporal dementia, progressive dementia, change in personality. Silver staining spherical aggregations of tau protein in neurons. Silver staining spherical aggregation of tau protein in neurons. Silver staining spherical aggregations of tau protein in neurons. Pick bodies. Silver staining spherical aggregations of tau. Silver staining spherical aggregations of tau protein in neurons. Silver staining aggregation of tau protein. Silver staining spherical. Silver staining spherical aggregation. Silver staining spherical aggregation of tau protein in neurons. That is pick bodies. Frontotemporal dementia, progressive dementia, change in personality. Protein aggregates in neurons. Protein aggregates in neuron from hyperphosphorylation of tau protein. Protein aggregates in neuron from hyperphosphorylation of tau protein, that is neurofibrillary tangles. It is present in Alzheimer's disease, Pick's disease. Protein aggregates in neurons. Protein aggregates in neuron. Protein aggregates in neuron. Protein aggregates in neuron from hyperphosphorylation of tau protein. From hyperphosphorylation of tau protein. Protein aggregates in neuron. Protein aggregates in neuron from hyperphosphorylation of tau protein. From hyperphosphorylation of tau protein. From hyperphosphorylation of tau protein. Protein aggregates in neuron. So it can be seen in Alzheimer's, Pick's disease. That is a neurofibrillary tangles. Silver staining spherical aggregation of tau protein. Silver staining spherical aggregation of tau protein in neurons. It is a Pick disease. Pick bodies. It is a Pick bodies. It is seen in frontotemporal dementia, progressive dementia, change in personality. Pseudo palisading pleomorphic tumor cells on brain biopsy. Pseudo palisading pleomorphic tumor cells on brain biopsy. Pseudopalisading pleomorphic tumor. Pseudopalisading pleomorphic tumor in brain biopsy. Pseudopalisading tumor, pseudopalisading pleomorphic tumor on brain biopsy. It is seen in glioblastoma multiforme, glioblastoma multiforme, glioblastoma multiforme. Circular grouping of dark tumor cells surrounding pale neurofibrils. Circular grouping of dark tumor cells surrounding pale neurofibrils. Circular grouping dark tumor cells surrounding pale neurofibrils. Homocyte rosette neuroblastoma medulloblastoma. Homocyte rosette. Circular grouping of dark tumor cells surrounding pale neurofibrils. Waxy cast with very low urine. 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 Chronic in-stage renal disease. Chronic in-stage renal disease. Chronic in-stage renal disease. WC cast in urine. Waxy cast in very low urine flow. Waxy cast with very low urine flow. Waxy cast in a very waxy cast with very low urine flow. Waxy cast with very low urine flow. It is seen in chronic in-stage renal disease. Circular grouping of dark tumor cells. Circular grouping of dark tumor cells surrounding pale neurofibrils. Circular group of dark tumor cells. Circular group of dark tumor cells surrounding pale neurofibrils. Circular group of dark tumor cells surrounding pale neurofibrils. Homocyte rosette. Circular grouping of dark tumor cells surrounding pale neurofibrils. Surrounding pale neurofibrils is surrounded by circular grouping of dark tumor cells. Circular grouping of dark tumor cells is circular group of dark tumor cells surrounds pale neurofibril. Pale neurofibril is surrounded by circular group of dark tumor cells. It is called Homocyte rosette. Circular group of dark tumor cells surrounding circular group of dark tumor cells surrounding pale neurofibrils. Circular group of dark tumor cells surrounding pale neurofibrils. It is seen in Homocyte rosette. It can be seen in neuroblastoma, medulloblastoma, medulloblastoma. Waxy cast with very low urine flow. It is chronic in-stage renal disease. WBC cast in urine. It is seen in infections like acute pyelonephritis and other conditions like transplant rejection, tubulointerstitial inflammation, transplantation failure, transplantation rejection, not failure, transplantation rejection, tubulointerstitial infection, tubulointerstitial inflammation. RBC cast in urine, that is seen in glomerulonephritis. Tram track appearance of capillary loop of glomerular basement membrane on light microscope. Tram track appearance of capillary loops of glomerular basement membranes on light microscope. Membranoproliferative glomerulonephritis. 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 MPGN. can be seen. Impingement is present. What are the features? Tram track appearance of capillary. Tram track appearance of capillary. Loops of glomerular basement membranes on light microscope. Membranoproliferative glomerulonephritis. MP MPGN. Tram track appearance of capillary loops of glomerular basement membrane. Tram track appearance of capillaries loops. Tram track appearance of capillary loops of glomerular basement membrane on light microscope. Anti-glomerular basement membrane antibody. It is seen in Goodpasture syndrome. Anti-glomerular basement membrane antibody. Anti-glomerular basement membrane antibody is seen in Goodpasture syndrome. Goodpasture syndrome. It is a glomerulonephritis and hemoptysis. 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 Cellular crescent in Bowen's capsule. 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 Bowen's capsule. Rapidly progressive glomerulonephritis. Cellular crescent in Bowen's capsule. Cellular crescent in Bowen's capsule. Cellular crescent in cellular crescent in Bowen's capsule. Cellular crescent in Bowen's capsule. Cellular crescent in Bowen's capsule. Rapidly progressive glomerulonephritis. Rapidly progressive crescentic. Rapidly progressive or crescentic glomerulonephritis. Rapidly progressive glomerulonephritis. Rapidly progressive glomerulonephritis. Crescent nephritis. Wire loop. Glomerular capillary appearance on light microscope. 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 Diffuse proliferative glomerulonephritis. Diffuse proliferative glomerulonephritis. Diffuse proliferative glomerulonephritis. Usually seen with lupus. Wire loop. Glomerular capillary appearance of light microscope. Wire loop. Glomerular capillary appearance. Wire loop. Glomerular capillary appearance seen in diffuse proliferative glomerular nephritis. Diffuse glomerulonephritis. Diffuse proliferative glomerulonephritis. Linear appearance of IgG deposition on glomerular and alveolar basement membrane. Linear appearance of IgG deposition on glomerular and alveolar basement membrane. Linear appearance of IgG deposition on glomerular and alveolar basement membrane. Linear appearance of IgG deposition. Linear appearance of IgG deposition on glomerular and alveolar basement membrane. Linear appearance of IgG deposition on glomerular and alveolar basement membrane. Linear appearance of IgG deposition. Linear appearance of IgG deposition on glomerular and alveolar basement membrane. Goodpasture syndrome. Goodpasture syndrome. Linear appearance of IgG deposition on glomerular and alveolar basement membrane. Linear appearance of IgG deposition. Linear deposition. Linear appearance of IgG deposition on glomerular and alveolar basement membrane. Goodpasture syndrome. IgG deposition on glomerular and alveolar basement membrane, which is linear appearance. Goodpasture syndrome. Lumpy bumpy appearance of glomeruli on immunofluorescence. Lumpy bumpy appearance of glomeruli. Lumpy bumpy appearance of glomeruli on immunofluorescence, that is post streptococcal glomerulonephritis. PSGN. Post streptococcal glomerulonephritis due to deposition of IgG C3. IgM C3. Post streptococcal glomerulonephritis. Post streptococcal glomerulonephritis. Lumpy bumpy appearance of glomeruli on immunofluorescence. Lumpy bumpy appearance of glomeruli on immunofluorescence that is seen in post-streptococcal glomerulonephritis. It is due to deposition of IgG, IgM, and C3. Necrotizing vasculitis, lungs, and necrotizing glomerulonephritis. Necrotizing vasculitis in lungs, necrotizing glomerulonephritis. It is seen in granulomatosis with polyangiitis. Granulomatosis with polyangiitis, PR3, ANCA, or ANCA, and Goodpasser syndrome, anti-basement membrane antibodies, Goodpasser syndrome, necrotizing vasculitis, lungs, and necrotizing glomerulonephritis. It is in granulomatosis with polyangiitis, and Goodpasser syndrome, anti-basement membrane antibodies. Now next one, nodular hyaline deposits in glomeruli. Nodular hyaline deposits in glomeruli, Kimmelstein-Wilson nodules. Kimmelstein-Wilson nodules. Diabetic nephropathy. Nodular hyaline deposits in glomeruli. Kimmelstein-Wilson nodule. Kimmelstein-Wilson nodule. Diabetic nephropathy. Kimmelstein-Wilson nodules. Nodular hyaline deposits in glomeruli. Podocyte fusions or effacement on electron microscope. Minimal chain disease, child with nephrotic syndrome. Podocyte fusion or effacement on electron microscope. Minimal chain disease, child with nephrotic syndrome. Spikes on basement membrane. Spikes on basement membrane dome like subepithelial deposits. Spikes on basement membrane dome like subepithelial deposits. Membranous nephropathy, nephrotic syndrome. 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 Thyroid-like appearance of kidney, chronic pyelonephritis. Thyroid-like appearance of kidney, chronic pyelonephritis, usually due to recurrent infection. Thyroid-like appearance of kidney, chronic pyelonephritis. Thyroid-like appearance of kidney, chronic pyelonephritis. Sorry. Thyroid-like appearance of kidney, chronic pyelonephritis. Thyroid-like appearance of kidney, chronic pyelonephritis. Granular cast in urine. Acute tubular necrosis. Granular cast in urine, 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 acute tubular necrosis. It is due to ischemia or toxic injury. Granular cast in urine, acute tubular necrosis, ischemia or toxic injury. HCG is elevated. This can be seen in multiple gestation heretiform mole choriocarcinoma Down syndrome. Multiple gestation heretiform mole choriocarcinoma Down syndrome. Elevated HCG. Dysplastic squamous cervical cell with racinoid nuclei and hyperchromasia. Dysplastic squamous cervical cell with racinoid nuclei and hyperchromasia. Coilocytes as HPV predisposed to cervical cancer. Coilocytes. Dysplastic squamous cervical cell with racinoid nuclei and hyperchromasia. Sheets of uniform fried egg cells. Sheets of uniform fried egg cells. Increase HCG, increase LDH, that is dysgerminoma. Sheets of uniform fried egg cells. Increase LDH, increase HCG, dysgerminoma. In dysgerminoma there will be increase sheets of uniform fried egg cells, increase HCG, increase LDH, that is dysgerminoma. Alright, so this areate granulosa cell arranged around collection of eosinophilic fluids. This areate granulosa cell arranged around collection of eosinophilic fluid. Disareate granulosa cells arranged around collection of eosinophilic fluid. Call Exner bodies. Granulosa cell tumor of ovary. Call Exner bodies, that is Disaerated granulosa cell arranged around collection of eosinophilic fluid. Disaerated granulosa cell arranged around collection of eosinophilic fluid called Exner bodies. Granulosa cell tumor of ovary. Chocolate cyst or chocolate cyst of ovary. Chocolate cyst of ovary is seen in endometriosis. Endometriosis frequently involved in both ovaries. Endometriosis frequently involved in both ovaries. Chocolate cyst of ovary. Endometriosis frequently involves in both ovaries. Mammary gland blue dotted cyst. Mammary gland or blue dotted cyst seen in fibrocystic change of breast. Fibrocystic change of breast. Blue dotted cyst or mammary gland cyst. Mammary gland cyst, there is cyst, fibrocystic change in change of breast. Fibrocystic change of breast. So now, as I have mentioned above, I'll be continuing 724 section 3 rapid review classical or relevant treatment. This is not a treatment, classical findings, lab findings and diagnosis. Alright, so I'll just complete the short few points. There are around 7-8 points. Okay, so let's start. Glomerulus like structure surrounding vessels in germ cell. Glomerulus like structure surrounding vessel in germ cell. There is scalar duval bodies or yolk sac tumor. Glomerulus like structure. Glomerulus like structure surrounding vessels in germ cell. Glomerulus like structure surrounding vessels in germ cell. Glomerulus like structure surrounding vessels in germ cell. Glomerulus like structure surrounding vessels in a germ cell. There is scalar dual bodies. Stellar dual bodies. Stellar dual bodies. That is stellar dual bodies or yolk sac tumor. Glomerulus like structure surrounding vessels in a germ cell. Scalar dual bodies. Yolk sac tumor. Rectangular crystal like cytoplasmic inclusions in Leydig cells. Rectangular crystal like cytoplasmic inclusion in Leydig cells. That is Ranke crystals. It is seen in Leydig cell tumor. Ranke crystal Leydig cell tumor. Rectangular crystal like cytoplasmic inclusion in Leydig cell, that is Leydig cell tumor. Rectangular crystal like cytoplasmic inclusion in Leydig cells, that is Ranke crystals or Leydig cell tumor. Thrombi made of white or red layers, that is lines of Jan. That is thrombi made of white or red layers, that is lines of Jan, ZASN. Arterial thrombus or layers of platelets or RBC. It can be due to it is a line of Jan, white lines or red layers. Thrombi made of white or red layers. Thrombi made of white or red layers. Thrombi made of red or white layers. It is a line of Jan. It is a line of Jan. It is an arterial thrombus, layers of platelets or RBC. Hexagonal double pointed needle like crystals in bronchial secretion. Hexagonal double pointed needle like crystals in bronchial secretion. Hexagonal double pointed needle like crystals in bronchial secretion. Hexagonal double pointed needle like crystals in bronchial secretion. It is a bronchial asthma. Charcot layered crystals, eosinophilic granules. Hexagonal double pointed needle like crystals in bronchial secretion. Hexagonal double pointed needle like crystals. Hexagonal double pointed needle like crystals in bronchial secretion. It is bronchial asthma. Here Charcot laden crystals and eosinophilic granules are present. Charcot laden crystals are and eosinophilic granules are present in bronchial asthma. Desquamated epithelial cast in sputum. Desquamated epithelial cast in sputum. Desquamated epithelial cast in sputum. That is Krusman spirals. CHMANN. Krusman spirals. Krusman spirals. D. Squamated epithelial cast in sputum. Krusman spirals. Bronchial asthma can result in rolled mucus plug. Rolled mucus plug. Krusman spirals. Desquamated epithelium cast in sputum. Desquamated epithelial cast in sputum, that is Krusman spirals. It is seen in bronchial asthma, which can result in hold mucus plugs. Honeycomb lungs on X-ray or CT scan. It is idiopathic pulmonary fibrosis. Honeycomb lung on X-ray or CT scan. Idiopathic pulmonary fibrosis. Idiopathic pulmonary fibrosis. Honeycomb appearance of lung in chest X-ray or CT. It is due to idiopathic pulmonary fibrosis. Iron containing nodules in alveolar septum. Iron containing nodules in alveolar septum. It is ferruginous bodies. Ferruginous bodies. It is seen in asbestosis, which has an increased chance of lung cancer. Asbestosis. Ferruginous bodies. Ferruginous bodies. Iron containing nodules in alveolar septum. Iron containing nodules in alveolar septum. So the next one is bronchogenic apical lungs tumor on imaging. 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 There is Pankos tumor, which can compress cervical sympathetic chain and cause Horner syndrome. Pankos tumor. Bronchogenic apical lung tumor on imaging, that is Pankos tumor. It can compress cervical sympathetic chain and cause Horner syndrome. So these are all the features that is present as a lab diagnosis findings and the diagnosis of disease. So I have just completed page number 724. In the next video, I'll be talking about the classical relevant treatments from 724, section 3, rapid review, classical relevant treatments. All right. So this video is mainly for revision purpose. Hope you have liked, and please subscribe to this channel. Thank you.